It is traumatizing to be living through a global pandemic and living through the viciousness of racism at the same time.
Two traumas, both hitting the Black community hard. New data from the Cuyahoga County Board of Health shows African Americans continue to have higher rates of hospitalizations and ICU admissions from COVID-19. As News 5's Jade Jarvis reports, officials say those health disparities cannot be fixed without first addressing the racism they face.
Of the county's nearly 2,500 cases, just over 40% are African American, with white patients making up nearly 47% of cases. But according to the U.S. Census Bureau, only about 30% of Cuyahoga County's population is African American, while about 63% is white. Further data shows an even grimmer picture, with African Americans making up 45% of patients hospitalized with the virus and 48% admitted to the ICU.
And in the time of COVID-19, people of color are less likely to be able to work remotely and have less access to paid sick time. What this leads to is a constant fight, constantly fighting for yourself, for your family, for your community.
Ramona Brazil, the Deputy Director of Prevention and Wellness with the County Board of Health, says that fight against structural racism starts as early on as childhood for some African Americans, and the stress can lead to mental and physiological impacts.
Chronic stress contributes to the development of chronic disease. Chronic diseases contribute to sicker and shorter lives.
Brazil says the answer to addressing these issues is to make sure everyone has access to things like quality education, fresh and affordable food, and health care, no matter their race or income.
Maybe it's too uncomfortable to hear, and maybe it's too divisive, and maybe it's too political. But ultimately, public health's responsibility is to work to improve the population's health. And we cannot do that when we ignore root causes of poor health.
Health Commissioner Terry Allen says officials have recently been able to provide more testing for African Americans and other vulnerable communities through the partnership between Metro Health and the county, and are working to expand that in the weeks ahead.
We're trying to focus on trying to schedule out over a course of 2 weeks in advance a range of settings that will include reaching people of color and other vulnerable populations in a variety of these settings that we've described.
Jade Jarvis, News 5.